So it's a real pleasure to now introduce Samantha Callan, who's the co-founder and director of the Family Hubs Network. I used to think that I was a big proponent of the Family Hubs, but Samantha's been championing this model since 2007, so I'm a relative newcomer here. Samantha will be talking about some of the foundations of the Family Hub model and also how Family Hubs help solve problems at a system level. So Samantha, over to you.
Thank you so much, Andrew, and good morning to everybody. I'm going to explain how Family Hubs bring together 3 decades of learning about solving family-based problems, summarise what families can access in and through these hubs, indicate the outcomes Family Hubs are pushing to achieve through integrated working and the early help front door, the need, as already mentioned, for a Family Hubs outcomes framework, and emphasise Family Hubs cost effectiveness. Family Hubs solve key problems. Now, looking at this first at the family level, families are not getting the support they need when and how they need it to address or prevent adverse childhood experiences related to poor family functioning and to prevent the need for costly late intervention. Now, everyone here knows that the issues underlying poor family functioning are typically complex and require a whole family approach. This often needs to draw in non-resident parents, extended family, and the wider community to achieve sustained progress. These issues include, well, practicalities, low budgets, poor housing conditions, unemployment, serious personal debt, disabilities, but also parents' lack of confidence around setting boundaries, which makes the whole job of parenting very hard, and many had patchy experiences of being parented themselves. Other relational difficulties in the family, such as parental conflict, mental health problems, unresolved trauma and adult life, which again can make parenting really tough. Trauma a child has experienced, perhaps through witnessing domestic abuse. And we know that unaddressed, these can lead to children's educational underachievement and disengagement, and then crime, or poor mental health, lack of well-being, poor physical health, including addictions, and ultimately these all undermine life chances. Parents' own physical and mental health is affected, their ability to be productive, to progress in work, to be healthy, to contribute to society, these all suffer when key relationships are not functioning well. Every family is different and each local area will have particular needs. So the Family Hubs network does not specify exactly what a family hub should deliver to qualify. And the hub is not the site everything is delivered from, has already been said. But we do say family hubs are the early help front door families can walk through to get help. So very quickly, what might be available through this front door? It's already been mentioned, early years health and parenting support. So all the perinatal health and early years services most families need. So the classical children's centre offering, which ideally includes birth registration, because this gives hubs the birth data they need to plan services, but also accessing the family hub early alerts new parents to other support, reduces any stigma associated with going through the door. And Bench Hill Centre in Manchester found that 100% of young parents who registered their baby's birth at this centre returned, which is just what you want. Parenting across the whole 0 to 18 age range, and often family hubs are the access point for help up to age 25 where there are special educational needs and disabilities. So that includes access to trauma-informed and mental health services for children, adoption, fostering, kinship care support, child-to-parent violence programs, and ways of engaging dads. Youth. Hubs can provide safe hangouts for young people where they can access trauma-informed services, and they're places parents can go with worries about drugs, county lines, gangs, etc., and get help to interrupt these lethal pathways. And the information they provide is intelligence for criminal justice agencies too. couple relationships, domestic abuse services, reducing parental conflict services. These are two different programs focused on different people, obviously. Support for separated families where conflict is still a major issue. Other adult support for alcohol, drug addiction, gambling addiction, debt counselling, welfare and benefits advice, employment support, adult education such as language classes. Now, helping families solve their problems can require solving a system problem. So it does prevention well, and it harnesses community engagement. Because the Family Hub is not just a set of services. What is key is someone coming alongside the whole family who can help them address the bespoke, help them access the bespoke support that they need. It was the 30th anniversary of the 1989 Children Act last year. And those who lamented an insufficiently changed landscape for needy children pointed to the lack of a focus on prevention, despite this being the cornerstone principle of the legislation. The Act specified every local authority shall provide such family centres as they consider appropriate in relation to children within their area. So families would receive help way before reaching thresholds for statutory child protection. Now, on the positive side, a range of other success factors have been honed over those 30 years, which will enable family hubs to fulfil the preventive intention of these statutorily mandated family centres. Because to work well, family hubs require establishing multidisciplinary teams, integrating their offer with existing service pathways and infrastructure, relational practice, taking a trauma-informed approach, building community capacity, statutory services working seamlessly with early help. Because at the end of the day, it is all about changed lives. And family hubs need to demonstrate they are meeting local needs, as the Isle of Wight and Doncaster have already outlined, and Essex will do too. So the spotlight has to be trained on the way family hubs work, on system evaluation, and specifically on outcomes delivered by integrated working, outcomes delivered by that early help front door, and how to measure these systematically. We've already been talking to Doncaster about creating an outcomes framework for all family hubs. But system evaluation, rather than just programmatic evaluation, is where the government is saying we and they need more evidence. So that's why the hefty research fund of £2.5 million announced in the March 2020 budget is really welcome. And in our conversations with government, it seems clear that this money has not been diverted away due to COVID. So we're going to be recommending that they commission theory of change evaluations in a set of local authorities to demonstrate the effect of the systemic change which has family hubs at its heart. Now, this bit's a bit nerdy. It won't last long, I promise you. But a theory of change is a theory or explanation of how and why an initiative works. So a theory of change evaluation of a family hub is a systematic study of the links between its activities, outcomes, and the social context. So this requires being really clear about those intended outcomes, these activities the hub expects to carry out to achieve them, and the contextual factors that are going to impact on the ability to achieve them, the potential to achieve them. End of nerdy bit. Okay, so I'm going to end on the $6 million question of cost effectiveness. Family hubs could be terrific if they are a more expensive way of achieving a set of outcomes than other alternatives. They might be an affordable luxury. So every local authority that has moved to hub model will obviously have a different story, but commonly we've found savings made by reducing the number of children's centres and delivery sites, co-locating staff. And one county council told us co-location achieved a 20% reduction in estates cost, a 15% reduction in IT infrastructure costs. Prioritising community engagement and outreach, and providing a service without walls, so rationalising buildings means staff can significantly increase their ability to reach, engage, actually work with local families rather than being tied to staff in buildings. Savings flow from working in a multidisciplinary way, freeing up highly trained and more expensive staff to focus on those with the greatest or more complex needs. And other areas provide help, but have made that shift in a more or less cost-neutral way, or with the help of earned autonomy from troubled families and existing budgets. So all of this is why we are not asking the government to fund a massive kind of Sure Start 2 infrastructure project, but we are asking for seed funding for local authorities through a 4-year transformation fund every area could bid into as part of post-COVID recovery. To sum up, the problem we are trying to solve is the lack of accessible family support, that known and trusted place in the community that the Isle of Wight mentioned. So if we don't have that, then we're not going to prevent the poor outcomes that are costly in human and financial terms. And we have been grappling with the systemic challenges needed to address this for some time. And the bottom-up solution of family hubs has emerged as an evolution of the Children Act 1989 Family Centre. We have learned an enormous amount since then about how to deliver a preventive approach, particularly the need to work in a more integrated way that is hand in glove with the community. And done well, there are clear savings to be made. This need not break the bank. Family hubs have to show that they can deliver family transforming outcomes across the major areas of need in an area. So it's not about prescribing how they work, but being clear about the principles they need to work to, and, as I keep saying, the outcomes. So I'm going to end on Lord Farmer's quote from the DCS of a very successful children's social care department, and the quote's already on the screen, who told us, "Family hubs is an idea whose time has come." Thank you so much.